Welcome to the University of Washington Tracheotomy Care Training video module on how to perform a tracheotomy change. By the end of this video, we anticipate you will be able to explain the indications and contraindications of tracheotomy change, describe the steps necessary to prepare for a tracheotomy change procedure, demonstrate the tracheotomy change procedure, list 3 ways to ensure the trach is properly positioned. This module will describe changing an entire tracheotomy appliance and not just changing the inner cannula. For more information about how to change an inner cannula, please see the module entitled How to Change an Inner Cannula of a Trach. A trach tube is usually routinely changed every 1 to 3 months to enable placement of a fresh, clean trach tube through an established tract. Otherwise, a tracheotomy appliance change may be performed when a different type of tracheotomy is needed, for example, a larger one or a smaller one, or a change from a cuffed tube to an uncuffed tube. Tracheotomy change can typically be performed at the bedside as long as the tracheotomy tract created at the time of surgery is well healed. This is felt to have occurred at about 5 to 7 days after the initial tracheotomy procedure. In a situation where the procedure is expected to be difficult or particularly risky for the patient, this may occur if the patient is obese or if the patient has had a difficult trach change in the past. Then the procedure may be performed in a physician's office or even in the operating room with better equipment and experienced assistants. At the bedside, a few elements are essential and several others are recommended. 1. Good lighting. 2. Personal protection, including eye protection and a mask, since the procedure can elicit a cough reflex from the patient. Suction device with suction catheter on and tested. The new appliance with an introducer in place and the cuff tested and thoroughly deflated, if applicable, and with lubricant on the tip. An assistant is highly recommended, particularly for retraction when needed and for performing suctioning. Another piece of equipment that can be helpful, especially for fresh or difficult trach changes, is a cricoid hook. The hook can be used to retract the airway up toward the skin and can also provide counter-traction against the forward pressure applied when the new trach appliance is advanced into the airway. It can be particularly helpful in an emergency situation. Also recommended is a shoulder roll placed below the level of the patient's shoulders to facilitate maximum neck extension. If the trach is sutured in, then a pair of scissors and forceps will be needed to remove all the sutures. Once preparations have been made, the procedure is as follows. All sutures securing the trach appliance to the skin should be removed. While the assistant holds the trach in place, trach ties are released. If the trach appliance has a cuff, the cuff should be maximally deflated. While the assistant retracts soft tissue away from the stoma site with one hand and holds the suction at the ready with the other, the tracheotomy appliance is removed. Any mucus is suctioned from the tract, and the tract is quickly inspected to ensure it is patent. With the thumb firmly holding the introducer in place, the new trach appliance is rotated into the trach tract and into the trachea following the natural curvature of a patient's anatomy. Once the tracheotomy appliance is in place, the assistant must hold it in place while the introducer is rapidly removed to enable the patient to breathe. The inner cannula is placed at this time if applicable. The assistant continues to hold the trach appliance in place until the ties are secured. If necessary, the cuff should be reinflated to approximately capillary pressure of 25 centimeters of water. The trach appliance ties must then be placed, taking care to ensure they are on tight enough to hold the tracheotomy appliance in place without causing undue skin pressure. As a rule of thumb, the ties should be tight enough that only 2 finger breaths can fit under them. Initially, after a new trach is placed, there may be some coughing while the airway becomes accustomed to the new trach tube. If the coughing persists or is associated with significant discomfort, however, the trach position should be checked and the procedure may need to be repeated to ensure that the tube is properly seated. Other signs that the tube is in proper position include airflow through the patent tube, ability to pass the suction catheter easily, and comfortable breathing on the part of the patient. The trach tube position can be checked with a flexible scope or X-ray to ensure it is seated safely within the trachea but well above the carina. In this module, we describe the procedure for how to change a tracheotomy appliance, including the appropriate preparation and steps as well as rationale and cautions.